Chapter 18, Introduction to Dental Imaging Examinations. The dental radiographer must have a working knowledge of dental imaging techniques. Before the discussion of the basics of the techniques, an understanding of the different types of dental imaging examinations is necessary. Dental imaging examinations may involve either intraoral projections placed inside the mouth or extraoral projections placed outside the mouth. The purpose of this chapter is to introduce the dental radiographer to the different intraoral imaging examinations used in dentistry, to define the complete mouth series, and to describe in detail the diagnostic criteria of intraoral images. In addition, the extraoral imaging examinations used in dentistry are introduced. Intraoral imaging examination. The intraoral imaging examination is an inspection used to examine the teeth and intraoral adjacent structures. Such intraoral examinations are the foundation of dental imaging. The intraoral imaging examination requires the use of intraoral receptors. Intraoral receptors are placed inside the mouth to examine the teeth and supporting structures. Types of intraoral imaging examinations. 3 types of intraoral imaging examinations are used in dentistry: periapical examination, interproximal examination, occlusal examination. Each of these examinations has a certain purpose and requires the use of a specific type of imaging receptor and technique. Periapical examination. Purpose. Periapical examination is used to examine the entire tooth, crown and root, and supporting bone. Type of image receptor. The periapical receptor is used in periapical examination. The term periapical is derived from the Greek prefix peri, meaning around, and the Latin word apex, referring to the terminal end of the tooth root. Periapical images show the terminal end of the tooth root and surrounding bone, as well as the crown. Technique. 2 methods are used for obtaining periapical images. 1. The paralleling technique, and 2. The bisecting technique. Interproximal examination. Purpose. Interproximal examination is used to examine the crowns of both maxillary and mandibular teeth on a single image. As the term proximal suggests, this examination is useful in examining adjacent tooth surfaces and crestal bone. Type of imaging receptor. The bite wing receptor is used in interproximal examination. The bite wing receptor has a wing or tab attached to it. The patient bites on the wing to stabilize the receptor. Technique. The bite wing technique is used in interproximal examination. Occlusal examination. Purpose. Occlusal examination is used to examine large areas of the maxilla or the mandible on one image. Type of imaging receptor. The occlusal receptor is used in occlusal examination. As the term occlusal suggests, the patient occludes or bites on the entire receptor. Although the major portion of the receptor is inside the mouth, a section of the receptor remains outside the mouth. Technique. The occlusal technique is used in the occlusal examination. Complete mouth series, full mouth series. The complete mouth series, CMS, is also known as the full mouth series, FMS or FMX, or the complete series. The CMS can be defined as a series of intraoral dental images that show all the tooth-bearing areas of both jaws. Tooth-bearing areas are the regions of the maxilla and the mandible where the 32 teeth of the human dentition are normally located. Tooth-bearing areas include dentulous areas, or areas that exhibit teeth, and edentulous areas, or areas where teeth are no longer present. The CMS consists of periapical images alone, or a combination of periapical PA and bite wing BW images. Bite wing images should be prescribed only in areas where teeth have interproximal contact with other teeth to examine the contact areas for caries decay. To include every tooth in all tooth-bearing areas, a range of 14 to 20 images may be included in the CMS. The number of images is dictated by the dental imaging technique used for exposure and the number of teeth present. For example, in the patient without teeth, 14 periapical images are usually sufficient to cover the edentulous arches. In the dentulous patient, the number of periapical images varies depending on which technique, paralleling or bisecting, is used. Receptor size is also dictated by the technique used. Diagnostic criteria for intraoral images. A diagnostic image provides a great deal of information. General diagnostic criteria for intraoral images are listed below. 1. Dental images must display optimal density, contrast, definition, and detail. 2. Dental images must display the least amount of distortion possible. Images must be of the same shape and size as the object being imaged. 3. The complete mouth series must include images that show all tooth-bearing areas, including edentulous and dentulous regions. 4. Periapical images must show the entire crowns and roots of the teeth being examined, as well as 2 to 3 millimeters beyond the root apices. 5. Bite wing images must show open contacts or interproximal tooth surfaces that are not overlapped. Extraoral imaging examination. The extraoral imaging examination is an inspection used to examine large areas of the skull or jaws. The extraoral imaging examination requires the use of extraoral imaging receptors. Extraoral receptors are placed outside the mouth. Examples of common extraoral images include the panoramic image, as well as the lateral jaw, lateral cephalometric, posterior-anterior, Waters, submental vertex, reverse town, transcranial, tomographic projections, and cone beam computer tomography, CBCT. Each of these extraoral examinations has a specific purpose and requires the use of certain receptors and techniques. The purposes, receptors, and techniques used in extraoral imaging are described in chapters 25, 26, and 27. Prescribing dental images. The prescribing or ordering of dental images is based on the individual needs of the patient. The dentist uses professional judgment to make decisions about the number, type, and frequency of dental images. Every patient's dental condition is different, and therefore every patient must be evaluated for dental images on an individual basis. For example, not all patients need a CMS. As detailed in the recommendations for prescribing dental radiographs, a CMS is appropriate when a new adult patient presents with clinical evidence of generalized dental disease or a history of extensive dental treatment. Otherwise, a combination of bite wings, selected periapicals, a panoramic image, or a CBCT scan should be prescribed on the basis of a patient's individual needs. Summary. Dental imaging examinations may involve either intraoral projections placed inside the mouth or extraoral projections placed outside the mouth. The intraoral imaging examination is an inspection of teeth and intraoral structures using X-rays. The three common types of intraoral examinations are periapical, interproximal, and occlusal examinations. Periapical examination is used to inspect the crowns and roots of teeth, as well as the supporting bone. Periapical receptors are used in periapical examination. Either the paralleling technique or the bisecting technique can be used to expose periapical receptors. Interproximal examination is used to examine the crowns of maxillary and mandibular teeth on a single image. The bite wing receptor and the bite wing technique are used in interproximal examination. Occlusal examination is used to examine large areas of the maxilla or mandible on one image. Occlusal receptors and the occlusal technique are used. The complete mouth series, CMS, or full mouth series, FMS, or FMX, is an intraoral series of dental images that shows all the tooth-bearing areas of the maxilla and the mandible and consists of 14 to 20 images. Periapical images alone, or a combination of periapical and bite-wing images, depending on imaging technique and number of teeth present. An intraoral image is considered diagnostic if it exhibits optimal density, contrast, definition, detail, and minimal distortion. In addition, a diagnostic periapical image shows the entire crowns and roots of the teeth being examined, and a diagnostic bite-wing image should show open contacts. The extraoral imaging examination is an inspection of large areas of the skull or jaws using X-rays.